The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon and welcome to today's Health IT webinar hosted by Patagonia Health. Today's webinar topic is Social Determinants of Health. I'll know it when I see it. My name is Amanda Gerard and I will be your moderator for today. If you are not familiar with the GoToWebinar platform, look out for the communications box on the right side of your screen. All attendees will be muted throughout the presentation, so this box is your way of letting us know if you have a question. The arrow in the little red box at the top of this communications box allows you to shrink or expand the box as necessary. If you have any questions throughout the presentation, please enter it in the questions field in this box, and we will address it at the end of the presentation. Colleen, if you want to go ahead and hit record. Oh, I've got it. Today, our presenter is going to be Dr. Colleen Bridger. Colleen has an undergraduate degree in international development from the School for International Training, a Master of Public Health degree from the University of North Carolina, Chapel Hill, and a PhD in Health Services Research from the University of North Carolina, Charlotte. Dr. Bridger is passionate about solving complex issues such as poverty, transportation, teen pregnancy, infant mortality, violence, youth smoking, and childhood trauma. Prior to launching her consulting business, Dr. Bridger was the assistant manager for San Antonio, Texas. She was also the director of San Antonio Metropolitan Health District in Texas and the director of Orange County Health Department in North Carolina. She's had numerous leadership roles and done the bulk of her work in local government, leading local health departments in North Carolina and San Antonio. Through her consulting company currently, Dr. Bridger is working on innovative solutions for the common good. She's working with nonprofits, foundations, and government organizations to untangle and address complex problems using a public health and ecological approach. She's currently doing work on mental health, public health, and education projects. Today, we're very happy to have Dr. Bridger joining us to share her expert knowledge on the social determinants of health. I'm going to go ahead and turn the presentation over now to you, Colleen, but I will be back with everyone at the end to help address your questions. Please do stay on at the end of the presentation to hear feedback on those from Dr. Bridger.
Thank you. Good afternoon, everybody. So today we're going to talk a little bit about social determinants of health. And a lot of people are talking about social determinants of health, especially now that the pandemic has shown a light on what public health people have been saying for decades, right? That the things that happen outside the healthcare system are much more important for good health than what our funding structures would suggest. But the challenge here is that, much like the confusing nature of this slide, everybody has a different understanding, a different definition, a different framework that they use when addressing social determinants of health. And as a result, we've fallen into this trap of knowing it when we see it, but failing to actually crystallize our definition. So during this webinar, we'll take a look at two different ways of framing and ultimately addressing the social determinants of health. Then we'll talk a little bit about how power and a lack thereof plays a role in addressing them. And then finally, we'll explore a concept of health justice and end with some concrete examples of how the city of San Antonio is addressing social determinants through a health justice lens. So I wanted to focus this talk today on two different perspectives about social determinants of health. The first one is the relatively recently released Healthy People 2030. And then the second one is the World Health Organization's definition of social determinants of health. And you can see the first sentence for both of them is very similar. Where it gets different is with WHO, I have highlighted the section where they explicitly address power and health inequities. And we're going to be unpacking that a little bit as we go through the presentation. So let's look a little bit more closely at Healthy People 2030. So Healthy People 2030 has 5 domains that they have identified for addressing social determinants of health. And those are on the right. You've got the healthcare access and quality, neighborhood and built environment, social and community context, economic stability, and education and access to quality. So those are their 5 domains that they are using in order to frame how they are going to address social determinants of health. On the left are what they have identified as key issues. So each of these have an evidence-based approach to addressing social determinants of health, and you can see those on the left-hand side. So let's look a little bit at these 5 domains. The first one, economic stability. For each domain, they have one goal. And here for economic stability, the goal is essentially to improve income. And so the way that they go through this, 5 domains, 5 goals, for each of the domains, they have specific objectives. So here are the specific objectives that they have listed for addressing economic stability. And you can see essentially what they're talking about here is looking at helping opportunity youth, addressing poverty, employment, hunger, and affordable housing. So if we look at the next one, education, access, and quality, again, the goal is to increase educational opportunities with a focus on starting early and getting people at least through the beginning of college. So again, these are the specific objectives that they have listed, and it's pretty straightforward. It's what we would expect to see. The next one, neighborhood and built environment. So neighborhood and built environment is clearly an area where there is a lot of research and a lot of experience. And so you start to see an increase in the number of objectives that the Healthy People 2030 have identified. But here, essentially, there's a heavy focus on 2 things. One, environmental health. There are 6 different objectives that are specific to the environment. And then asthma. There are 7 objectives that are specific to addressing and mitigating asthma. Now, there are some, onesies and twosies here, individual items looking at violent crime, broadband internet, motor vehicle accidents. They repeat the housing not being more than 30% of AMI. And there's one health policy that focuses on having the recommended amount of fluoride. So moving on to the 4th domain, healthcare access and quality. This one is much like the last one, very loaded with objectives. This is basically, I would say, the sweet spot for public health. We know what works here. We have a lot of experience here, and so there are a ton of objectives. This is what I would call kind of quintessential public health, and we are super comfortable here. Finally, the 5th and last one is this social and community context. And so again, the goal is to increase social and community support. And for those of you on the webinar today who are working in mental health, here's where we see a lot of the mental health and well-being indicators. So you can see the different objectives here and what they want to focus on in order to increase social and community support. So, okay, this was a quick recap of the Healthy People 2030 definition and approach to social determinants of health. Essentially, conditions in the environment that affect health, 5 domains, 5 goals, and nearly 100 specific objectives. So now let's look at the WHO definition and how they kind of hone in on what they mean. So they have 3 what I will call domains so that we just stay consistent with the language. The first one is improved daily living conditions, and they further define that by the circumstances in which people are born, grow, live, work, and age. The second one, tackle the inequitable distribution of power, money, and resources. This is really important. This is a little bit different from the Healthy People 2030 approach. And then the third one is measure and understand the problem, and then assess the impact of action. So let's look at some of their specific objectives. Many fewer, but again, falling into the categories of income and social protection, education, early childhood development, social inclusion. So there's a lot of overlap and similarity between the Healthy People 2030 and the WHO Social Determinants of Health objectives. But let's go back to that primary difference that I pointed out, which is the one of power. So in the WHO definition, they explicitly say, tackle the inequitable distribution of power, money, and resources. And Healthy People 2030 never really says anything about power. They talk around it through the categories of civic participation, discrimination, incarceration, and social cohesion. So I wanted to look at the social cohesion one as an example to kind of compare and contrast how WHO is addressing it versus Healthy People 2030. So I've got them side by side. On the left is how the WHO is going to address social cohesion. On the right is how Healthy People 2030 is going to address social cohesion. And so I'm not going to read through each of these, but as you are looking at this slide, you can see that WHO's interventions clearly have a focus on upstream system changes that explicitly address power. So if you look at that second one, for example, a common vision for social cohesion and health equity by adopting a people-centered right to health framework. That's very much about what we're doing around power structures. Compare that on the right to the list of interventions that the Healthy People 2030 have put together. And, you know, to me, this reads a bit like a list of people we, the powerful, want to help. And that's very different than what the WHO is saying in kind of tearing down that power differential. It's almost like on the right-hand side, we're recognizing the power differential, but what we want to do about it is just help people more. And, you know, to be honest with you, there's very little on this list on the right-hand side that harkens to our public health kind of principles of prevention by upstream systems changes. So let's look at what I'm calling health justice, because I think that the way I would summarize the way that the WHO is addressing social determinants of health is that they are using health justice in order to do that. But health justice isn't really something that we talk about here in the United States. In fact, when you do a Google search for a definition of health justice, there's no kind of nationally recognized definition that I could find. And so I wanted us to just spend a little bit of time talking about what does this mean. So for me, what health justice means is it takes social justice, which is equal rights and equitable opportunities for all, and adds health equity, which is, you know, achieving conditions for optimal health for all people. And again, in the health equity definition, we do talk a little bit about recognizing and rectifying historical injustices, which I think is kind of a nod to that power challenge that I brought up earlier. So for me, health justice is social justice plus health equity. And the best definition that I actually found about health justice is from the San Francisco AIDS Foundation. And their definition is the attainment of health equity actualized when structural factors no longer determine health outcomes. Health justice is reached when all people possess the economic, social, and political power and resources to make decisions about their bodies and health. That emphasis is mine, but that is their definition. So you've seen this slide. I just want to remind you, this is the 5 domains and then the key areas on the left-hand side. So let's look a little bit more in depth at these key areas. So the top ones are what I would call the public health comfort zone, right? These are things that public health has been doing for decades. We're good at it. We know how to do it. There's evidence that says that when we do it well, it works. But to be honest, the results that we've achieved over the last several decades of focusing on these specific social determinants of health have not been phenomenal. We've had some bright spots, but rarely do those bright spots scale to nationwide interventions and nationwide improvements. So let's look at the bottom part of this. Which is the area that, I wonder, what is public health doing here? What are we doing around civic participation and discrimination and social cohesion? There are some objectives here, but as we saw in the social cohesion aspect, they're very much focused on the individual. They're not about systems changes. And in my opinion, they kind of miss the point of addressing this power differential. So I guess the question then is health justice possible? And, I don't know the answer to this, but I think that it might be if we, as public health, can effectively lead population-based strategies that dismantle the systems that created the currently powerful. And that's not an easy thing to do, right? That's the rub. Public health is largely a government function, a government that was created by powerful people to ensure an infinite legacy of power. And so as we're kind of pondering this question about, is it possible for public health as a government entity to dismantle that system? I don't know. I mean, I think what we saw during the pandemic is the lengths to which the powerful will go to protect their status at the top of the hierarchy. And so it seems like we're at this precipice in public health where those who have the power are doubling down and using any means necessary to keep their power. And the community, the citizens are wondering how that serves them. And so, this is not new. This is not a new revelation. We've been having this debate in the United States since before we were formed. But what is new is public health's role in this conversation. Public health has a role in the solution to this problem. But until we explicitly embrace and really address health justice, we are not going to achieve population health. And population health is something that public health has been kind of claiming as their end goal for longer than probably many of you on this webinar have been alive. So this is where we are right now, is we have begun to understand that the system that we have created to address public health problems is a system that caters to the powerful, and having a community where there are people with more power than others is creating some of those health inequities that is leading to poor health outcomes. So, I guess the question here is, can those of us with power in the public health system work towards health justice, or do we need some sort of different structure that isn't a government-funded, government-run public health system in order to truly address the power differential that's driving the health inequities that are influencing the social determinants of health for our population? And so, I don't know what the answer to that is, but I hope that we can continue to have discussions around this as we find our way out of the pandemic and spend some time kind of rethinking and revamping what public health looks like. So I wanted to spend a couple minutes kind of looking really concretely at what this might look like if we were to work through government to start to create a social determinants of health intervention through a health justice lens. And so as was mentioned, I just recently left the city of San Antonio, where I served as both the public health director and then later as an assistant city manager. In my role as assistant city manager, I was part of the team that developed the recovery and resiliency plan in response to the COVID-19 pandemic. I also had the honor of running point on responding to the pandemic. So the last 2 years have been unlike any other, as those of you who've been doing this same work know. But I was super excited to be part of this kind of longer range thinking about how do we make sure that what we're seeing right now in the height of the pandemic never happens again. And so what San Antonio did was it took a two-pronged approach. The first thing it did was create this recovery and resiliency plan. And I'm going to talk a little bit more about that. And then the second thing they did was really focus on the health department and create what we call the strategic growth plan for the health department. So recognizing that public health's role is to address these social determinants of health, and how do we do that? So let's first look at the recovery and resiliency plan. And so when we were creating this recovery and resiliency plan, we started with guiding principles. And it was really neat to see that the number one guiding principle was public health and safety. Rarely, when you're part of a full city initiative, does public health lead the conversation. And, we were fortunate that we were doing this in, April and May of 2020. So the pandemic was very much on people's minds. We had done some surveys of the community, and for the first time ever, the community was identifying public health as one of their top priorities. And so capitalizing on that, we created this recovery and resiliency plan, very much steeped in social determinants of health. So you can see, number one priority, public health and safety. And then, infusing that equity lens through everything that we did, getting really creative with how we would use braided funding, because there was a lot of different funding streams when it came to money coming to cities and health departments to address the pandemic. And, we had money coming in for housing, for homelessness, for small businesses, for broadband. We had little dribs and drabs and pots of money here and there. But what we did was weave that all together into one comprehensive plan. As I mentioned earlier, we also focused on community resilience. What we found during the pandemic is that the city of San Antonio had about the same rate of COVID-19 cases as other big cities did. But where we really did poorly was on our case fatality rate. We had more people, once they got COVID-19, die as a result of that infection than other places throughout the United States. And what that tells us is that we had a population that was less healthy going into the pandemic. That was not a surprise. We knew that in the health department, but this pandemic gave us an opportunity to talk about that through a different lens that seemed to really resonate with people. And then this last one, this well-being and a focus on generational family well-being, really kind of looked at how can we help address poverty, but not just for this particular child at this particular point in time, but really make an investment in how do we address poverty from a generational perspective because of the connection between poverty and health outcomes. So those are the guiding principles that we used in creating the plan. And then here are the primary categories of work that the plan was developed around. So we had a workforce development bucket in the plan, and that's where we really focused on job training and helping people who lost their job as a result of the pandemic, or people who were currently unemployed due to other reasons, help get them into a strengthened, easier to navigate workforce training and development system. This was so successful that last year, the citizens of San Antonio actually passed a sales tax referendum that dedicated more sales tax revenue specifically to workforce development. So this now has a solid ongoing funding source so that we will always be able to help people get the training that they need to have high-paying jobs that are hiring right now. The biggest area where we focused was on housing security. And I think a lot of big cities focused on making sure that people didn't get kicked out of their houses. We went a little bit farther than that in creating hubs of resources and support to address the root causes for why people couldn't pay their rent in the first place, and start to work with our citizens on how do we address those root causes. So we created hubs where people could come and get help if they were getting ready to be evicted from their homes. And even during the moratorium, we were able to keep the money flowing to the landlords so that they could pay their bills, while also working on some of those root causes around housing security and affordability. The next item that we worked on was digital inclusion. So we had a whole bunch of kids at home going to school, and some of our school districts literally lost connection with 20% of their students because those students did not have access to the internet. And so working with the funding that was provided through the CRF and then later through ARPA, and then adding in some additional city dollars and resources, we have budgeted over $25 million to expand access to broadband internet for students in their homes. And then small business support. Small businesses were also disproportionately affected by the pandemic. We had more small businesses, restaurants, bars, et cetera, close because of the pandemic than any other kind of business. And so, 50% of our businesses are small businesses. They hire a tremendous number of people. That is the upstream response to poverty. And so we really wanted to make sure that we could shore up those small businesses and make sure that they could continue post-pandemic and provide their services and continue to hire people. And then, of course, it was the COVID-19 Recovery and Resiliency Plan. So we also had, additional resources going to the health department to do the testing, the contact tracing, later the vaccination, and also working very closely with our emergency response partners to make sure that they were able to transport people who had COVID-19 to the appropriate medical facility. And there were some times in the last couple of months where that was really, really challenging for our system. And there was lots of national coverage about the fact that we had a 30-minute period of time where we were really challenged to have ambulances available to take people to the hospital when they called because of the COVID-19 pandemic. So if you are interested in this plan and more details, this is a snapshot of the dashboard from the City of San Antonio's website. So you can go onto the website and see more about where the money is coming from, how the money is being spent, how many people we've helped, et cetera, et cetera. So there's a lot more information on the website about this. Then the other thing I wanted to talk about was the health department's strategic growth plan. So the health department had its strategic plan before the pandemic started, and we had just started getting into implementing some of the areas in that strategic plan. But then the pandemic hit, and it was all hands on deck, address the pandemic. But we were able to, in the lull between the last wave and the current wave, come up with the strategic growth plan, which built on the existing strategic plan for the health department, but really took the lessons that we learned from the pandemic and infused them into this new plan. And this new plan essentially doubles the health department's funding that it currently receives from the city. It starts out with that funding coming from federal and to a lesser extent state resources, but then it transitions to the city picking up 100% of the cost of this expansion. And that was one thing that was really important to us as we were putting together this plan was, yeah, there's a lot of money. There are a lot of resources coming down for the next 2 to 3 to maybe 4 years. But then what happens? And those of us who had been through either 9/11 or the H1N1 pandemic were familiar with the kind of bolus of federal resources that then dry up, and then you have to go back to business as usual. We did not want to go back to business as usual, which is why we developed this plan. And it's a 5-year plan, and it's in year 6, the city completely funds it. So the focus areas for this plan are mental health, again, recognizing the effects that the pandemic had on our community's mental health. There has been a lot of conversations, there's been a lot of data, there's been a lot of, I think, to a certain extent, destigmatization of mental health around the pandemic. And unfortunately, the mental health system, at least here in Texas, is not a robust system. And so that's what public health does, right? Public health fills the gaps. One of the gaps that we saw was a huge gap in mental health. And so with a focus on upstream mental health, the health department developed its plan around how are we going to work on addressing mental health issues. And then this concept of health justice. So we really embraced the concept of health justice and made it concrete. So council, like a lot of other cities throughout the United States, passed a racism is a public health crisis resolution. What this does is it operationalizes the work to address it. It says it's not enough to just resolve to do something about this. You need to say, and here's what we will do. And so the health justice component of this plan very clearly lays out, and this is what we are going to do. Then on the access to care piece, again, with a focus on how do we involve the community in identifying what needs to be done. This isn't about, transportation to the doctor's office. This is about how do we pull everybody together and figure out the best way to create a system that's accessible by everybody when they need it, regardless of their ability to pay. And then finally, the technology and infrastructure. We definitely experienced a challenge in our pandemic response when it came to technology and infrastructure. We didn't have enough staff, we didn't have enough technology, we literally did not have enough fax machines. And so this category of work in the strategic growth plan really kind of addresses how do we make sure that the next pandemic, the health department has all of those systems in place and all of those partners that work within that system in place in order to make sure that we have a little bit better response. So I wanted to make sure that we had plenty of time for questions. So that is the high-level overview of the presentation. And I think Amanda's going to figure out the magical nature of getting questions submitted and answered. So Amanda, I think I'm going to turn it back to you.
Okay, sounds good. Thank you so much, Colleen, for sharing your expertise with us. This is a really informative webinar, and it's a very, very important topic to everybody now in both public and behavioral health. If anybody does have any questions, again, like I said at the beginning of the webinar, that box to the right side of your screen, if you have that collapsed, you can click on that red arrow and it'll open it back up. And there is a section under there called questions where you can type your question into the field. And we'll be more than happy to get Colleen to answer that for you now. I have some comments and some different things, but I don't have any current questions yet. But you guys make sure you go ahead and take the opportunity to ask that. But just as far as like my own personal question, Colleen, something I read a lot about is about the technology and infrastructure, of course. Here at Patagonia Health, that's the business that we're in, addressing public health and behavioral health needs on the technology side. And I know I've seen a lot of like grants and things coming through for that. And I've seen a lot of public health experts talking about these technology needs. Were there any things that you and your staff had found that was working for you, or certain funding that people can reach out for that you want to share with our viewers?
Well, I think with one of the lessons learned with the pandemic is the fact that we have a bunch of siloed technologies. And so there is now plenty of federal funding to address these silos and do a better job of tying them together. I alluded to we didn't have enough fax machines. So we were getting thousands of faxes an hour at the health department at one of the peaks of the pandemic, because there wasn't an electronic reporting requirement for lab results. And one of the things that we had to do was calculate a positivity rate, and you can only calculate a positivity rate if you have both the negative and the positive labs. And so we went from getting a couple dozen positive lab reports on reportable communicable diseases to, tens of thousands of faxed lab reports that had to then be manually entered into a system in order for us to calculate that positivity rate. So that was a challenge, and helped us recognize the need to have electronic lab reporting systems. And, both, I think the federal government and here in Texas, the state government are working on that. But we need to make sure that they create a system that is end user friendly, or I think we'll continue to have challenges with that.
Absolutely. And I know there's been a lot of work done just during the pandemic as far as HIEs and registries and having us all be a lot more connected digitally, and then more apps and tools coming out from different companies to help with, scanning needs and connecting the EHRs and all kinds of fun stuff. I know our company's been working on stuff like that. We do have a couple questions now. One is, have you identified a social determinants of health screening tool for clients and LHD?
So we have not. I know that North Carolina, for example, has done a really nice job with their Medicaid managed care programs of screening for and being required to address social determinants of health needs. It's the dilemma we have every time we try to roll something out in public health, which is, do you take a universal precautions approach, or do you take a targeted treatment approach? And I think with social determinants of health, it's probably more effective to really just focus on those systems and fixing them, explicitly addressing the power differential, making them accessible and workable for everybody, rather than spending time, resources, and energy on trying to figure out which individual might need help. That doesn't mean that we can't also work with partners to create these, hubs and other ways for people to access services and care. But I think public health's real strength is on the systems development piece, and you don't have to screen every individual in order to fix the system. I make that same argument when it comes to adverse childhood experiences too. So that's a soapbox of mine.
Thank you so much. We also have another question that it is, what are the questions that should be asked to all patients and clients to collect data around health and equity so that we can collect the data to analyze? And there was a comment that went with this that said, I've seen some questions around employment, access to PCP, et cetera, on the behavioral health, but I'm not sure if we collect this kind of data on the public health side. Just wanted to understand, how did San Antonio collect all this data at the patient level?
So, the other thing that question brings to mind is the fact that I think the primary reason why there's a significant difference between the Healthy People 2030 social determinants of health approach and the WHO social determinants of health approach is data. And I think what the Healthy People 2030 wanted to do is make sure that they had data to evaluate the fact that what they were doing was working. And I think because WHO is global, their data needs are less granular than one nation's data needs. And so what you're getting at is the question I think I already answered, but I'm going to take it in a different direction, which is we do need to figure out how do we collect the right data at the right time in order to evaluate the effectiveness of these systems changes, because that's the only, I think, hope that we will have to be able to continue to make these changes is if we can then point to data and say, see, look, this is making a difference.
Right, definitely. We also have another question. Social determinants of health has been around for many years. And I know that a lot of people have heard about this before, but why only now, and has it taken this long to really become an important topic that's getting as much focus as it is right now?
Yes, that's a great question. I don't know that I have the answer. I have an opinion. And my opinion is the pandemic. You know, I think that for the first time, what public health had been saying, which is when people, because of where they are born or where they live or where they work, have worse health outcomes, bad things are going to happen. And the pandemic crystallized that, right? I mean, San Antonio would do maps and we would show this is where the people were most likely to die from COVID-19, and it was in the areas that had the highest poverty rates and the highest challenges with their education system, et cetera, et cetera. Everything that public health's been saying, the pandemic kind of translated it into real words and real consequences that I think people who hadn't been paying attention were able to understand. And so you have that, and then you have this whole social justice movement that also kind of collided with the pandemic. And for the first time, we have this incredibly active generation of social justice activists that are trying to really challenge the power and make the changes that we need in order to prevent these outcomes from happening in the future. And so I think it's the perfect storm. Unfortunately, like all storms, it comes when public health is worn slam out. And so if we are to really be able to address these challenges and do so in a meaningful way, we have to figure out how to catch our breath from the pandemic, which seems to show no sign of stopping, and simultaneously go back to what we do, which is address root causes through systems changes.
Absolutely. It's a lot of big work that we're doing. It looks like that's all the questions, but we do have a great comment that kind of asked a question that was a common one that I can actually answer. Let me see, maybe one more popped up. Oh yeah, we have a lot of questions about will the presentation be shared? Everybody, yes, we will be sharing this to you. We'll be sending this out to your email. We're also going to have this listed on our website, so you guys will be able to review all of this information again. And just a great comment from one of our viewers. Oh, we do have another question. Even before the pandemic, social determinants have been discussed in the literature. The data collected for the pandemic made inequities very explicit. We use terms like health equity and social determinants, but have to do a much better job explaining what these mean for the general public. So this is like a comment about that. Do you have anything else to add to that, Colleen?
Just, preach. I completely agree.
And then let's see. Do you think there'll be a push from the federal government for social determinants of health? Where I want to get to is that public health departments' data and data from private practices and hospitals is shared and collated to identify the needs of the community.
I hope we can take the whole HIE concept and make it better, and really be able to to have access to that data. I'm a big data geek, and so I would love for us to be able to figure that out. I don't want us to get lost in the data, though. I mean, we have a once-in-a-lifetime opportunity to completely dismantle a broken system and rebuild it from scratch, and we need to do that. And if the data isn't perfect, that's okay. We need to grab this opportunity and figure out the data later.
Mm-hmm. Let's see here. And we've just got a really great comment that someone says they're very interested in exploring this further. And the concepts presented tie really well into their upcoming research on leadership development at a local health department. And we did have some questions about getting your contact info. And of course, lots of people want access to this recording afterwards. So if you want to go ahead, Colleen, and go to the next slide, we are going to share your contact information with everybody. So again, thank you so much, Colleen, for meeting with us today on this really important topic and sharing your expertise. If you would like to get in touch with Dr. Bridger, if you have more questions later, or you would like to reach out to her through her consulting services, you can see her website listed here. Colleen, and her email address is colleen@cbridgerconsulting.com. And you can also visit her website at www.colleenbridgerconsulting.com. And if you have any questions and would like to learn more about our company, Patagonia Health, and our secure electronic health record and billing solutions and how that might help you out in public health and behavioral health and tools for this pandemic, you can reach us at our website or send us an inquiry there at patagoniahealth.com. All right. Well, thank you everybody for joining us. And thank you again, Dr. Bridger. It's been wonderful having you on today.
Thank you. It's my pleasure.
All right. Bye, everybody.